All right, so if you guys don't know me, I am Julie Hare. I am a board certified family medicine doctor. I am an MD, not a DO. Um, I work at Pocahontas Memorial Hospital, which is the critical access hospital down the road here in Pocahontas County. I work in the rural health department, so I see patients in typical HMO settings. I am also the owner of Allegheny Integrative Medicine. So this is my coaching practice, and I just clarify this really quickly for people. I do not see patients through this avenue. This is health coaching. If you don't know what that is, we can talk about it some other time. And so this is really the platform on which I'm talking to you today. So I'm not representing my employer. And it is the correct day today. Okay, so because I'm also a person with letters after my name, it's appropriate for me to give you a disclaimer. If I mention an institute or a product or something like that, I'm making no money on it. I have no affiliations. I was talking about Dr. Morris's microparasite tincture today. I have no affiliation with Dr. Morris. I have done education through iLads. I would probably mention them briefly. I'm not associated with them in any sort of way. I also want to really tell you guys, I am not what Lyme literate doctors would consider it as a Lyme literate doctor. Does that make sense? I'm not, I haven't gone through all the iLads training. I don't run Lyme clinic. I consider myself a frontline grunt. I am seeing Lyme. I've had Lyme myself and treated it. I know things, I have experience. This is where I'm coming to you as. And so, what that really invites is more of a discussion environment rather than just me getting up and talking to you like some sort of authority. I want to hear your experiences. Every story I get from you guys, I learn something. And hopefully you'll learn something from me too. And so that is to say, this is a discussion. This is not medical treatment. I am not treating anybody today, to let it be known. And this is, if I had to give a spoiler for the whole talk, it's the last bullet point, which is that Lyme and associated infections are hard to resolve, and there are no one-size-fits-all treatments. None. So you must do your own homework. You must take command of your own health, and you have to practice your due diligence in all of those aspects, and researching, paying attention to your body, trying things and committing to things, and hanging in there. It was just a little bit more about me. I am local. I've lived here full time for 10 years. I live on a gorgeous piece of mountain outside of Edgeray. We are restorative, regenerative farmers is the word for it. So we try to grow a lot of our own food, which sometimes we're successful with that and sometimes not so much. We homeschool. I wear many hats, but probably the most important thing about me is I have been and continue to be a patient. And I feel like that is the thing that makes me relevant and probably makes me the type of person that you want to talk to because I've been there, right? So any sort of doctor or, somebody who goes into business because they got sick, had an experience, it lit them up, you are that experience of going through the fire makes you the most precious thing that other people can access. It doesn't mean that you can't be a good oncologist if you've never had cancer, but it actually does help. So this is kind of what we're going to talk about. We need to, of course, define Lyme disease if we can. I'm going to kind of go over the great Lyme controversy. If you don't know, it's controversial, and there's many reasons for that. It's a tough infection to get rid of, and there's been a lot of oh gosh, I'm going to say it. There's a lot of gaslighting in Western medicine clinics from doctors. There's been a lot of I would actually say abuse on the part of physicians towards patients. And it makes me really, really sad to say that. But you just need to read the opening pages of Stephen Herod Banner's Healing Lyme book. And it's not I'm saying that as a statement of fact. If you see what this particular doctor says in regards to, people and their Lyme experience, it's just outrageous. So we need to do better in listening to each other. We've probably all had that conversation in the last 2 years. We're obviously going to talk about Lyme disease, and a little bit about co-infections, like just kind of touch on it. Really, the focus is on Lyme, on the spirochete Borrelia, and looking at treating acute and chronic infections in that integrative approach. And of course, because this is the Mountain Medicine Weekend, we're going to be highlighting Appalachian herbs as a kind of a core of that. So we'll jump right in. What is Lyme? So Lyme is a microparasite. So it's a bacteria. It's something called a spirochete. It's an anaerobic bacteria. It means it lives in a low oxygen or no oxygen environment. There are several different kinds of Borrelia that can make humans sick. We're usually talking about the BB kind, the Burgdorferi, which was named after Dr. Burgdorferi, who described it back in the 60s. It is, I always want to point this out. So this is the same bacteria family that gives you syphilis. So syphilis used to be a really big thing. It's kind of making a comeback in certain areas of the world and in this country. And it will do things like make you sick, and then you get better, and then you get weird painless lesions, and then you get better, and then you get weird like heart and nervous system issues, and then you can die. What does that sound like? Lyme disease, right? So, we've seen this before. This is, there's something very special about this bacterial family that is tenacious and strange. So it's confusing, and it can be a very serious disease. For a lot of you know that you can chronically live with Lyme. We can chronically live with cancer now. There's all kinds of, diseases that are kind of gaining longer and longer periods of chronicity in the human body. But certainly people have died from Lyme disease. It's fairly international. There's still some holdouts out there in the world that don't see Borrelia infections. Hawaii appears to still be one of them, but we actually there's some research that says it actually originated in Europe, in Western Europe, and it came over here. And the talk really these days is Lyme is really kind of an outdated name, because there's different Borrelia. There's different co-infections. They can kind of act like each other. We're kind of calling it all Lyme. And so I'm not going to go into that with you in great detail, but just, we always want to try to speak as specifically as possible for clarity, right? That's the purpose of language, is to clearly convey ideas and thoughts. And so when you say Lyme, it's becoming a loose term, and there's a number of people that know that, and you should know that too. So why is Lyme so controversial? Well, ILADS is an organization, stands for International Lyme and Associated Diseases Society. And so they are, in my opinion, the absolute forefront pinnacle of a current institution that is really understanding these diseases and doing excellent research and actually really engaging in patient care. You can go on their website. They have little like mini seminars they'll do for like $50. Anybody can jump on them and register. You don't have to be a doc or some other sort of licensed healthcare provider to attend. You do to, get certification through them, but they're just they really understand it, and have been bold enough to actually call out the CDC, who is still really standing on their antiquated laurels from like 1994, still giving you the same statistics and the same kind of treatment guidelines, and it's just not working. And so, what they say, Lyme is a clinical diagnosis dependent on history, physical examination, and supported by appropriate laboratory testing. So a lot of you have gone to the doctor and have been like, I really am sick and I really think I have Lyme disease, and they're like, but it's negative. That doesn't mean anything, and they did not give you appropriate care. And you should know that. So diagnosis is really hard. most people land on LabCorp testing or similar, which basically looks at proteins associated with antibodies that you make to Lyme. The problem is that is a very variable thing that happens in people. Some people will make great antibodies and you can detect it. Some people make them really fast in the beginning and then they go away. So it's like your antibody response is like a flash in the pan. And some people never make antibodies to it. I don't know. I mean, have you ever been in a household environment and everybody got sick, but some people got it way worse and somebody never got sick at all? So welcome to human physiology, right? It's really complicated. So there are independent labs out there now that are doing much better testing. One company in particular from California called iGenix. It's a few $100s. They actually, some of their best tests uses urine. I've sat through some of their seminars. They know their stuff. They are a good company. If you are really trying to figure out, is this Lyme or not, what's going on with me, it's probably worth your $350 to go ahead and do some iGenix testing. If you want to do some serum stuff, you can actually, most people can easily get the tests ordered themselves, or if you have a healthcare provider that can help you out, and usually it's just like a phlebotomy fee draw. You can go into basically an independent lab and say, hey, can you draw this for this company? And then you send it off yourself. So, and I've had a number of patients actually do that here at the hospital. And again, I'm not going into any of this in tremendous detail. We could go off in 27 different avenues in Lyme and talk about it for 3 days and still not go over everything. But that's kind of, the initially landing on the diagnosis is really, really hard. And a lot of doctors aren't educated in what Lyme can look like and how it can manifest. So, okay, we need, history and physical examination. But if your doctor doesn't know what they're looking for, then they're going to miss it entirely. So there's that. And so lots of controversy over treatment. So again, our treatment guidelines from the CDC are really stinking old now, and it's not working. And the reasons why, 21 days of doxycycline doesn't work for people is probably complicated. One of the answers may be that it never really did. iLads will tell you that if you get bit by a tick, they recommend 20 days of high-dose doxy, period. I generally don't do that with patients, but we'll get into all the other things that I do talk about with patients. So if you're just throwing antibiotics at somebody for like post-exposure prophylaxis and you still want to stay up till 2 o'clock in the morning and eat pizza and ice cream and drink beer, then yeah, probably take 20 days of doxy, right? These guys are using, when you talk to Lyme literate doctors, there is not one doctor out there that does not use herbs. Not one. They'll use weird antibiotics, but they will always bring in herbal formulas every time. So it is a multi-modality approach, especially for people where you've really locked into a chronic phase. Big controversy over time of attachment before transmission. So this is, it was on me, but it wasn't on me very long. And so the question is, or the answer to that question is maybe. So we used to say, it has to be an adult tick to transmit some sort of parasite or infection. That's not true. The nymph stage can absolutely be infected. It looks like some ticks actually can infect you in a matter of hours, where some ticks do actually need to be attached for 24 or more. My take on this is when somebody comes to me and say, well, I got bit by a tick, and I say, let me see it. And if they had any kind of skin reaction at all, I highly, highly recommend that you treat in some way. Of course, the problem is that we often don't know they were attached, right? So that goes back to the diagnosis portion of it. If you don't know that you had a tick on you, you didn't have an initial reaction, you had some sort of latent immune system reaction, then the whole thing's out the window. We often talk about the bullseye reaction, or what is probably called an EM, an erythema migrans. So that's That's like a red circle that actually moves out and actually looks like a target. And that is what is called being pathognomonic for infection. So that means like if you see it, you have Lyme disease. What we have found over the years is that a lot of people will have erythema migrans, but it will actually not look like that classic bullseye, right? Like not everybody looks like the textbook. So I have definitely seen textbook EMs, but I really have come to learn that any sort of like good juicy red spot is probably in that category somewhere. And if you biopsied the person on the periphery of the redness, you would actually pick up bacteria. That is actually the bacteria spreading out and moving into your system. So lots of controversy over chronic Lyme. And when I was in residency, I was told by a number of attendings or senior physicians that chronic Lyme was not a thing. You were treated, and something else was wrong with the patient. And so, I believed that because that's what I was told by some very smart and well-seasoned doctors. And of course, that's not true. Especially Lyme, it does weird stuff. So Lyme initially gets into the bloodstream, but it actually doesn't like to stay vascular. It likes to become an extravascular thing. So it will actually ride in the interconnective tissue. It will ride on the outside of your blood vessels. It will make something called a biofilm. So it all mats together and kind of protects itself from the immune system. And so it can actually go dormant. It actually has these little kind of dormant individual what people call spore form, where the bacteria just kind of hunker down, or again they become these kind of inert biofilms that herbs and a lot of herbs and a lot of antibiotics just don't penetrate. And then life happens to you, right? Where maybe you went through a big stressor, maybe you're not taking very good care of yourself, maybe you're eating some trash, and then all of a sudden all this other stuff comes out, and so there's this incredible interplay of waxing and waning, what we call bacteremia. So that literally means bacteria in the blood, where you can actually, which explains what people with chronic Lyme are experiencing, where you can have good days or bad days, right? So for those of you who've had that experience, that's likely what's going on. And if you kept a really careful journal about, your habits and your sleep and, your symptoms and that sort of thing, you would probably start to see patterns about how these periods of repeat bacteremic waves actually coincide with other sorts of physiologic stressors. Does that make sense to you guys? Okay. And then there's other challenges too that kind of go into this whole bucket of controversy. So there's co-infections, right? So there's anaplasma, there's babesiosis, lots of different kinds of chlamydia citiae. I'm forgetting the genus right now. Starts with a silent P. So these things are often carried along with tick bites, and so you can have more than one thing. Usually, the good news is that a lot of the co-infections respond to the same things that the Borrelia infection responds to. So if you're treating one, you're usually treating most of them. Sometimes you have to do some extra things, but 9 times out of 10, you can get there in kind of one shot. So we really want to prevent chronic Lyme. I think this is really where Lyme becomes a huge problem, right? So you have to be aware of it, right? So, obviously protecting yourself from tick bites is one thing. My daughter is up on the hill. She gets bit probably 2 to 4 times a year with the tiniest ticks. I mean, I would have to roll her in deep, I don't even know, we don't use stuff like that in my house, to prevent these things. I mean, she's a kid in the woods, what do you do? That's why I kind of came up with the topical tick bite kits that some of you guys purchased today, which is not my idea. That came straight out of Stephen Herod Beener's book. I was like, this is brilliant, why aren't we doing this? I'll make some. Just be aware that it is a problem, and it can be a problem for you. My biggest thing is treat acute Lyme. If you get a bite, treat it. Why wouldn't you? Take at least a few days of doxy and stay on some herbs for a month. What is the big deal? I mean, it's insurance, right? You're like, we insure our car and we insure our boat and we insure our house and we insure our own health. And but it's like, oh, but this tick bite, but if you don't know, right? If you don't know that probably every single tick now that you encounter has some sort of pathogen in it, then you aren't really motivated to treat that. Right. And if you don't know that you may or may not have an acute phase reaction to it, then you may not be motivated to treat it. Right. This is the biggest one. So the third one is really probably what a Lyme talk should be about. But again, we're talking about herbs today, but we can't talk about Lyme without talking about it. We have a problem in this country, and I don't know if anybody noticed, but we're pretty sick. And there are multiple reasons why that is so. Most people have some good portion of understanding of what they do or don't do that contribute to their good health or their lack thereof. And so when we are trying to heal ourselves, there is no amount of doxycycline and no amount of Teasel that is going to help you if you don't help yourself. Doctors don't heal you, you heal you. We just help you along. So I have lots and lots and lots of stuff to say about lifestyle. That is my main training. I mean, that is like the heart and breath of functional medicine. Really, when you get down to it, it's certainly the heart and breath of Ayurveda and traditional Chinese medicine is, like we were talking about energetics and like hot and cold and dry and like all this stuff and like learning a different language around your physiology and around the way that you interact with the world and how you feed your physical and energy body is really the heart of it. And that's a really big statement, which may make sense to some of you and may make sense to not make some sense to some of you. And that's fine. We can talk about that more, but, and I'll repeat it again in a little bit, but it's, if you are trashing yourself, or just like, or one of my favorite sayings is, well, I've got a lot of stress in my life, but it's all good stress. We're like, well, I mean, I get it. I too live with I'm living with an overwhelmed life right now. And, and as I get older and I really have to like, become this higher spiritual person that says no for the sake of it. And, to kind of close this bullet point here with my general thought on where we're going as a species on the planet is, I think that is really where we talk about like, where humans are going in the 2.0 generation. I think that's really where we need to land, is we need to get back in touch with the spirituality of us, which teaches us self-control and saying no for the sake of it, which is what we're not doing right now. And then there's, of course, herbal support. So that's what we're going to hopefully get into here in a minute. I threw this up. Dr. Horowitz is one of these famous Lyme literate doctors. He does a lot of teaching through iLads. I actually, if you can't really read this, because I probably can't really read it off my screen, I actually have it on the table out there. Probably a lot of you guys saw it because I brought some of my library with me today. And this is a questionnaire that he gives people when he's going through Lyme. And you're like, well, what is this? This is like everything, right? And so why did I put this up here? Well, awareness for one thing, right? But also I would actually question Dr. Horowitz, like, how helpful is this really? I think that this is, again, helpful in the whole umbrella of diagnosis. So I don't want anybody to look at this, take it home and be like, I marked off like 27 out of the 30 things and I have Lyme disease. Not necessarily so, right? Because diagnosis is based on history, physical, and appropriate laboratory testing, right? So just it's a piece of the puzzle. And again, I'm going to just, repetition is king, you guys. Treat acute Lyme. If you get bit by a tick, do something. Don't do nothing, please. And again, the spirit is to embrace integration. And that's what some of these lovely doctors are teaching you. I have people in my life who are like, I would never take an antibiotic and I would never give it to my children, and they don't. and they like pull through. And, I've watched some kids get pretty sick and be like, oh, okay, they pulled through, and it's interesting. I mean, certainly we are in a culture that expects to get better really fast. When you learn a lot from reading history books. And so when you read through historical tomes and even like fiction novels that will bring out like practices of past times, like people would get sick and they'd be in bed for a month, and they'd get over it. And we don't do that anymore. We go get our antibiotics, our steroids, and our like antivirals, and then the diflucan that's going to chase the yeast infection that I gave you from giving you antibiotics. And and is there anything wrong with that? Maybe yes, because it's all kind of on a spectrum, right? Like we don't want to be sick in bed for a month. That I think is inappropriate, but also we need to learn how to support ourselves and do other things other than just like the pill for the ill business, right? And I say that because herbs are in that category. When we start to, like, people get really excited about herbs because they can be really, really helpful. But again, lifestyle, you guys, like if you are like, I'm going to take this teasel and this doxy and not do anything, then that is no different than going to your HMO based doctor for your pill for the ill. It's no different, and it will work about the same. So my admonishing lecture to everybody. Okay, talking about chronic Lyme a little bit. So did we mention that Lyme could become chronic and it was really hard to treat? It's a commitment. And so this is like, it's steadfastness and habituation that wins the race is probably how I would say this. ILADS really is like you treat for at least 9 months. 9 months, you're doing something every day. They put people on antibiotics for that long or even longer. I have never put anybody on antibiotics longer than 90 days. And have had fairly good results with some people. And then some people who have done antibiotics here and there so much that they just refuse to do it anymore. And that's a whole other thing. Lots of herbal antibiotics too. So again, you don't just take Doxy or Zyvaxin or whatever it is that you're being offered. And I just named a few here. Everybody I think knows oregano and thyme. Garlic is a big one. Cat's claw is a big one. Grapefruit seed extract is actually really helpful. And there's a lot of parasite formulas out there. I mentioned again, Dr. Morris's. It's my pet favorite. I think it works really well. I think he's a good company. And again, not endorsing him. There's a lot of other similar ones out there like him. There's Lyme teas. If you guys look at my lovely set of books out there by a woman named Rachel Weaver, if there is a set of herbal books that you guys should own, it is those. She is amazing. She's this little Mennonite mama, and she treats like her whole village. She's got all these incredible stories. She's helped me so much over the years, just really interesting combinations of things that absolutely work. She's big into tea, and I really don't like herbal tea. I would actually rather take a tincture, honestly, and I don't like alcohol. But papaya actually is something, papaya leaf is something that's used a lot. And so she'll talk about that. So if you're drinking like a quart or two a day for like 3 months, it's a lot. Lifestyle changes. Maybe I'll say that again. Oh, lifestyle changes. Let's say it again. And let's break that down for a second. So, you go to your doctor and he's like, yeah, you got to lose weight. So you got to exercise and eat better. And you walk out of there and you're like, but I thought I did that. Like, what am I doing wrong? And again, I'm not going to go into the details of it, but just, so the first thing I always want to step back and say, like, forest for the trees. Oh, there are so many wonderful things about this country. One of them is not food. We do everything wrong with food. And it is so hard because even as you learn what's right about food and how to approach food and how to feed yourself, there's like nobody around you doing this, right? So it's just, the temptation to like slide backwards and eat some trashy gluten or like eat when you're not hungry or eat at 10 o'clock at night or, like all these little things that we do, and especially on the aging body that now has an infection, is just so degrading. Sorry, I'm a little tired at this point. So it's really, I would say at the end of the day, you've got your energy body, right? We talked about this energy body, physiologic body. So, aside from really obvious things that will totally tear you down, like abusive relationships or extreme depression or something like that, it is 85% diet, straight up. If you can get out of your own way and stop overfeeding yourself, your body will heal itself. And so I'm not recommending 30-day water fasts and stuff like that. I've certainly known people who've done them that have worked. I've done a lot of detox programs, like advanced detox programs in Ayurvedic clinics that have been life-changing for me. So learning the lesson of stepping outside of your normal routine in some way, in some regular form, is really powerful. And when you look at ancient cultures and old religious practices, they all have these systems in there, right? Heard of something called Lent? Like the Jews fast, the Muslims fast, like, on a regular, like and it's like not even hardcore, like you eat dinner and then you just wait until the next day and you eat dinner again, and that's actually really powerful. The human body is supposed to empty out on the regular, and we just don't do it enough. Occasionally I'll have somebody with the opposite problem where you guys don't know how to feed yourself. Tend to be like your kind of like your naturally skinny people who get distracted and they don't really have like hunger signals like a lot of the rest of us do. And so that's a different conversation. Sometimes we're actually not feeding ourselves like regularly, and that will tear down the body in another way. Yes, yeah, yes, yeah. And yeah, that's an Ayurvedic thing, actually. So Ayurveda recognizes that in like body types, like it's a magic trick. You can look at people and be like, you need to fast, but you need to actually set a timer and eat. And you would actually like, it like brings you like back into focus, like it feeds the little animal body that feels like it's dying inside. Anyway, sorry, I'm going off on a tangent. So there's a lot to diet. Diet is definitely the big thing, but stress and sleep. We have to sleep. We have to sleep at all costs. I'm not like a big pill pusher, but it's definitely like, okay, can we do like some sleep hygiene to address this issue? If not, let's try to take something for sleep, because we must sleep. Certainly a lot of us don't need like 8 or 10 hours of sleep, but like 6 or 7 like solid hours of sleep is key. So if you're not sleeping, think really hard about that. Some of us really need excellent hydration. We're very sensitive to our hydration status, just like feeding ourselves on a schedule. Exercise. So this is the other one. Remember, Lyme is anaerobic. So what happens when you infuse yourself with a whole bunch of oxygen with aerobic exercise? You're going to really irritate it, right? We need to sweat. We have like 4 main detox pathways in the body. So we sweat, we pee, we poop, we exhale, and then women for a period of time have a 5th one and they menstruate. So we need to use these natural channels. And so, yes, if you can't exercise, get in a sauna. But if you can exercise, don't tell me that you're getting in the sauna to sweat and not increasing your heart rate. That's not actually working as well, okay? And if you can't exercise, there's something called breathing practices. So there's yogic breathing practices. There's actual like pulmonary therapy breathing practices out there. You can find them on YouTube. So using the breath as a detox pathway is really powerful. Massage is also really powerful. So you can do self-massage. You can go pay somebody for a massage. Rachel Weaver actually recommends regular massage for chronic Lyme disease patients. I certainly would too. Detox baths are really great. You can do those with herbs. You can do those with Epsom salts. You can do that with bentonite clay. There's a charcoal. Nobody really wants to take a bath in charcoal, but you can. So there's a dozen ways to cut a detox bath. And smile. So we have this little yogic practice where you sit and you imagine your heart smiling. So everybody close your eyes. Put your feet flat on the floor. Take a nice, deep but not excessively deep breath in, and draw the scattered mind to your midline, the middle of you, the tube of you, and smile in your heart. And when you're ready, open your eyes. It's so easy to not do stuff like that, but it's so easy to do it. So the mind and the body want to know each other, and that causes a lot of problems. It causes chinks in the armor where things like Borrelia get to come in and take hold. And so we live in not just a world full of like candy bars and chips, but also a world that makes us live up here. That's where a lot of dysfunctional eating comes from, it's the reflexive need to connect body and mind. Because what happens when you eat something like cheesecake at 10 o'clock at night? Ugh. Right? It's not a great way to get there, but it gets you there. And if it's the only thing you know, then that's the thing that you're going to reflexively go to, is that big, heavy, grounding, sweet dopamine snack that like suddenly has you in your body, right? Versus like, I'm going to lock myself in the bathroom for 3 minutes and close my eyes and breathe and put my hand on my chest and ask myself what I really need. So I'm totally zooming you through some coaching, but that's kind of the baseline of the story. Okay, so herbs, I promised we would get there, and here we are. Okay, so we are going to talk about local herbs and a mushroom. I'm gonna stand on some colleagues' shoulders over here who probably told you really everything you need to know about reishi, but we'll talk about it a little bit more. And I'm going to throw a wrench in here. So Erica asked me to talk about Appalachian herbs, and I am throwing in an invasive species, and I'm going to talk about that. So you're gonna get my unsolicited opinion on this. Okay. So here's the first one, and most of us know it because it all like made us really frustrated today. You guys got to know Teasel, and so she's sitting out there with her roots cut off and now in little tincture bottles, and it looks like a bunch of you grabbed tincture. There's some extra tincture bottles left over. Please feel free to grab more. So this is Dipsacus sylvestris, also known sometimes as Phelonum, but according to sources, sylvestris is the most accurate genus now. It is a biennial. It is actually really not native. It's a European introduction, but it's non-invasive. So we love it. Although, I don't know, it's everywhere. It's just not choking out a lot of other wildlife. Again, we talked about this. We're going to tincture the root of this plant, and preferably the first-year root. And I didn't put a picture up, but we can find one. And so that's when you just have the leaf rosette on the ground and the root is super, super tiny. Small doses, we taper up slowly. We talked about that. So we start out with a drop a day for a week, and then maybe a drop twice a day for a week. And then we go up, and then Buhner says to get up to 3 drops 3 times a day if you can. One of the reasons why this is so loved but not used very much is because it's very potent, and it has the potential for that Jarisch-Herxheimer reaction, or what people call herxing. And so this is when you have a massive die-off, like you've broken up the biofilm, which is what we think Teasel helps with. And you get this, like, and you're doing all the other things, and you get this big, like, bacterial kill that your body acutely reacts to. And so it will feel very flu-like. You can have gastrointestinal symptoms. You can be like, oh my God, I'm getting worse. This is my Lyme coming back. It can be really scary, which is why we start low and go slow. If that happens to you, if you are taking something like Teasel, you're working with Teasel, and this happens to you, you stop. You're going to take charcoal and put it in a quart jar and pour water on top of it. So usually about a 1/4 cup of charcoal, like activated charcoal, water, swish, let it settle, drink, repeat. And so you keep using the same charcoal, like washing it basically and drinking it. Yes, Jess?
I was writing and listening, but I heard a 1/4 cup of charcoal.
1/4 cup of activated charcoal in a quart jar, fill it up with water you trust, swish it around, let it settle, drink off the top, repeat. Okay. Yeah. Good question. Yeah, make me repeat, guys. I talk fast sometimes. That should help. And then going back to the dose where you did not have that reaction. There's not a lot of really good information. Like some of these things I have active alkaloids and things like that on them. And Teasel is somewhat studied, but not as well as others. It's a very well-known, long-time used herb because it was used for muscles and joint pain. And so herbalists, like if you have a lot of joint pain with Lyme, like this is your jam. And you can use it topically. So what I would do is I would actually make a salve out of it as well. So you could be taking a little bit by tincture, and then you could be rubbing it all over your body. And that would actually be pretty safe. We always take it with antimicrobials. You don't just take it alone. Yes, question in the back. Varieties of teasel?
Yeah.
There's probably some like sub-varieties of teasel, but they're all really sylvestris. So they can look, plants will look different. This is actually an interesting question and probably should be addressed. So especially for people who are newer to herbs, plants can look very different depending on where they grow. Soil conditions, moisture conditions, wind, altitude, other sorts of plants around them, whether they've been sprayed and they come back or they've been mowed and they come back. And so things will, like, you'll be sitting there going, is that really that? I'm not sure, and so, it's good to have a book. It's good to learn, to speak a little bit of botany, to learn a little bit of plant anatomy. If you take the walk with me and my husband tomorrow, we're a good team. So I know uses and he is a really good botanist. So he knows his Linnaeus terminology, he knows his Latin, and he knows how to teach you about like how to describe leaf margins and like floral inflorescences and all these sorts of things. So if you're around tomorrow, come walk with us. We'll teach you a little bit more on that. And again, we don't take teasel by itself. I think I said that. Black walnut. Okay, so all right, so we played with teasel. I'm going to get up over here. I'm going to come get some stuff. So I have samples of all these things that we're talking about. So back here, I have a bowl of black walnut. So actually, I'm going to hand this to you. So we're passing around a bowl of black walnut, but they're not black, they're green. That's what they look like right now. I just picked those out of our backyard yesterday. So in Lyme, we use the green form. We use the whole of the green. You'll see, I know, it smells amazing, doesn't it? So you'll see I have one that's cut in half when you're passing around. So the nut is very soft right now. We don't want that part, we just want the whole. So you're gonna scoop out the middle. And you can tincture that as well. So black walnut has, which is Juglans nigra, by the way, has a number of really interesting components in it. It's full of quercetin, which I think a lot of people have probably heard of. That's a very popular nutraceutical. It's considered an antioxidant. Helps you like scrub up free radicals in the body. So basically, you're making like your peroxides and your like excess CO2 that's acidifying and that sort of thing. It helps mediate that those pathways. When they get black, they get really full of iodine. So that's the confusion between the green and the black. The green is used for more like antibacterial properties, and the black is used in thyroid conditions for the iodine content. There's also a unique component in it, protein in it called jugalone, right? It's Juglans. This is also thought to be the jugalone is really thought to be the antimicrobial aspect of the black walnut, and azelaic acid also is a polyphenol. So the husks are primarily used, but also sometimes the hulls of the nut itself, the bark and the leaves. So the whole parts of the aerial parts of the tree have been used, and it's just people really like black walnut. It's actually really traditionally used in dental care as well. My Rachel Weaver books have a lot to say about using it specifically for dental care, but the green husk was historically used in syphilis. So what did we say syphilis was related to, right? And again, this is kind of like teasel. We do it in lower doses. Although some people do tolerate higher doses, and again, it's just low and slow. It's you playing around with things and deciding what works for you, what makes you feel good. Sweet wormwood. Okay, so I'm going to go back and I'm going to grab the next one. Okay, so we're passing my bouquet around of Artemisia. So I've doped my bouquet. So it's not all sweet wormwood. So there's actually two kinds of artemisia in this. And Katie and I were talking about this last night because we had a nice little debate in the backyard of a friend's house about artemisia because they can be a little confusing. So the silvery, fuzzy, very to me it's much more fragrant than mugwort. Is what we're talking about, sweet wormwood or Artemisia annua. The other one is mugwort, also an Artemisia, but not as antimicrobial as the wormwood is. Artemisia is also a transplant. You can find it around here a lot. Again, not invasive. I am not a traditional Chinese medicine person. Qinghao. So it's very, very much used in traditional Chinese medicine. It's actually considered a digestive bitter. And basically anything that's good for the gut is going to help your immune system, right? So it's a long time principle of all of these old systems of medicine, certainly functional medicine. If you've got something wrong with the gut, diet, you're going to have something wrong with the rest of you eventually. So anything bitter helps you digest and gets your digestive system moving. So a lot of people have probably heard of Swedish bitters. If not, it's a thing. It's been around for decades. Take a little capful in the morning. I will use mugwort as a bitter. Sometimes I'm out in the garden first thing in the morning, empty stomach, take a bite of it. I mean, you guys can go ahead and taste it. It's not going to hurt you. In fact, I invite you to do it. But so anyway, these things are good for the gut, but also good for the system. Yes. Yeah. So right. So the Artemisia. Right. So I should have said that. So Artemisia absinthium. Gosh, I'm forgetting the genus. Exactly. So that everybody knows absinthe, which was this herbal, kind of psychedelic infused liquor that's very popular in parts of Europe. Has been legalized and illegalized and legalized again. And so this is related, but not as. Sweet wormwood is much safer. I would never recommend anybody taking the absinthe form of it. It does have medicinal properties, but it also has a lot of really strange side effects.
Have you tried it?
Have I ever tried absinthe? I have actually, but like as a taste, not enough. Yeah, I had a friend from Czechoslovakia who always had some on her for some reason. And I don't like liquor, so I just booze is like not my thing. So I tried it to say I tried it, but I did not take enough of it. So plus we were at work, so it was like 25 years ago, guys. Research. So Artemisia has something called artemisinin in it, sesquiterpene lactone, and the latter is thought to be the antiparasitic component of it. People use the whole plant. We dry it or we tincture it. I use it topically a lot. It's actually a mild analgesic. So like my first aid butter has wormwood in it. So it helps soothe sore muscles, and it actually takes the sting out of like cuts and bites and stuff. The Native Americans used artemisias for hopelessness. So it has a really beautiful energetic, and it's just so I have both of these come from my yard, and they're both about 4 feet tall or more, and they're just gorgeous. I mean, they especially the sweet wormwood. It's at the foot of the yard, and it's just this big silvery thing, and the light comes up on it in the morning, and it looks like it's praising the sky. There is just something about it that if you guys ever heard of the doctrine of signatures. Raise your hand if you have. Right, so, okay, most of us not. So that is the whole concept of it looks like this, so it's good for that. Basically, like something that looks like a liver. Like the leaf is shaped like a liver, or the root looks like, your gallbladder or something like that, and then we're going to take it for that thing, And so for a long time, people well, in modern times, people have kind of poo-pooed the whole doctrine of signatures thing, but I don't know. The more I study plants, the more I see it. So that would be one doctrine of signatures that I could make up in my mind.
I was wondering about your black walnut comment with teeth. How hard it is as a tooth, like that could be myth, based on
right, or like a cavity, right? It's like black like a cavity. It's really supposed to heal cavities. That's what they use it for. So like black walnut tincture as a simple, like a one thing, and you just apply it and apply it and apply it and apply it. I mean, this is one of the reasons why herbs have just fallen out of favor. Is you just have to use them a lot. It's not like a big potent, big pharma pill where you take like it lasts 36 hours. So there's a tops versus bottoms thing that I came across, and I never really heard that before, which was interesting. So you always learn something when you're researching tox, like whether the tips do something different than the bottom of the plant does. And I don't know if you've ever heard that. Certainly when you look at Artemisia, it will really start to get quite branchy at the bottom, and the tops are tender. And I mean, way back when I thought I was going to study botany and I was learning about like hormonal gradients and the way plants intercommunicate and grow and do chemotaxis, there are different things going on in the apical meristem, which is the growing tip, versus lateral meristems, which are the things that come out from the side and where they grow from. So maybe. It's also been used as anti-malarial, and what's good for malaria is good for Lyme disease. We can get a lot of GI side effects in high doses, and it can cause some liver inflammation. So we use it for short bursts. So this is something where I would say you can play around with it in a more acute phase. Like I am feeling really bad. I'm going to take some wormwood for like 5 days, 3 days, and you kind of feel it out. People use it again in tincture, but they also use it in a dry form. It's a great medicine. It works really well. It's really, really expensive if you buy it as a pill. It's like $75 a bottle. It's like one of the most expensive supplements out there. So if you know somebody who has some, take a piece home with you. I have tons. Pick it. It's part of the Hulda Parasite Cleanse. So this is a book that you can buy. I have not used her protocol. I am putting it out there as information. Remember, I am not treating you guys. We're discussing things. And so she uses wormwood cloves and black walnut specifically. And so you can look her up. She is online and her book is on Amazon. All right, reishi. Can somebody reach back and just get the reishi mushroom back there? It's right there. Just start passing that around. So we have a mushroom to talk about. And it is very abundant here. So the Ganoderma genus is it's interesting. It's and I'm gonna let my EB fungi people like totally weigh in if I say something maybe that isn't right. So from what I've read, Ganoderma. So there's Ganoderma applaudium, right? The artist conch, right? And so that's kind of like everything is considered to be kind of like an applaudium umbrella, where you have like it's like shellac mushrooms, right? Like the shiny rishis, basically. We're specifically talking about tsuge. So the genus is designated by the tree that it grows on. So this is tsuge. This came off of hemlock. And so this is the one that's often used. And so
just
I think.
So I'll just speak out.
Yeah.
These are mushrooms next week and such. So the reishi is they used to think it was Ganoderma lucidum that we had in the eastern U.S. They changed it to Curtisii one, so we don't have lucidum in North America unless it's cultivated.
Okay.
And that's just, but to me they're fairly close. And tsuge is called like varnish shelf. It's not even referred to as being a reishi.
Interesting. Okay.
In general, it's kind of like a fad to call everything.
Right. It is a fad to call everything right. So what Michael's saying, it was a fad to call everything reishi, and that is what I read too. Is the Curtisii is kind of like the more sought after. It's a little bit more yellow.
That's what I always call. Lucidum when I.
So yeah, if y'all find one, call me. I've never found one. We find this in buckets, so I've been playing around with it. And it's the magic mushroom, man. I mean, I have a whole book out there that you guys can read. I put in just a tiny bit of what that book talks about. That book goes into some really, it's the Fungal Pharmacy, which is a great book. And so it talks a lot about all the triterpenes and the very specific polysaccharides like the ganodermadiol, the ganoderic acid beta, like all these things that I listed. These are all so reishi is interesting. So and a lot of mushrooms I think are probably in this category, and you guys can correct me if I'm wrong. So they're considered, a lot of them are considered adaptogenic, protective and detoxifying, but not directly antimicrobial, with an asterisk there, and I'll get back to that. What they seem to do is do a lot of genetic manipulation in the body. So one of the big ones is reishi appears to modulate a protein called a gene and a protein. It's a protein product called P53. So this is, if you ever took Genetics 101, you would have learned about P53. So this is the protein that is active in mitosis. When a cell starts to split, P53 is there as like the cop being like, that doesn't look right. This looks like it might go wrong. This is going to be mutated, cancerous something, and it induces apoptosis, which is programmed cell death. And so reishi helps regulate that. It helps like that work better, basically. So very, very fascinating. So I think that's one of the reasons why people get such good like oxidative stress help, and like they feel like it has a relaxing sense to it. It's just helping the body work better and clean up a little bit more. Now, the ganoderins, there's like A, B, C sub 2, like, but the B and the C specifically apparently do have some direct antimicrobial effect. So I would say reishi would be a great support, and you guys learned all about how to like extract it. My book says to boil it for like 2 hours, but certainly me dipping, like how I used to like dip it like in a tea bag is probably not doing much. Double extractions, that sort of thing. I mean, the Chinese call it, it's like lingji, which is like plant spirit or tree of life mushroom. There's all kinds of practices around, like if you really loved and lusted after a woman, you would go find a reishi in the shape of like antlers and give it to her. I feel like this romantic thing to do in China back in the day. So it's, yeah, Rishi's got really cool stories around it. Okay. Last but not least, yes, Erica's showcasing my non-native invasive. So we can pass this around. This is Japanese knotweed. It probably should stay in the basket, so it's so top heavy. It's gonna just like dump the quart jar if you guys want to look at it. Okay, Polygonum caspitatum. Sorry, I did not learn Latin later in life. So this is in the rhubarb family. If you, some of us were talking about that you can eat the shoots. If you cut it, it's going to be like juicy and mucilaginous. It's become very famous because it's a source of resveratrol. For those of you who have not heard of that, this is another one of these sexy nutraceuticals that's out there now. Resveratrol is a mitochondrial supporter. What's that? So it's kind of where the rubber meets the road as far as where your energy comes from. So you make something called adenosine triphosphate, or ATP, in your body. This is the fuel of your body. This is how everything moves in your body. It uses this little molecule that has phosphate groups on it to like bind and unbind things and walk things along and make your muscles move and make your brain work and make neurotransmitters happen. You know, it's really what functional medicine is always talking about, is mitochondrial medicine. Anyway, so resveratrol will help you make ATP actually by stressing your mitochondria out. And this is what it does. It actually works kind of like low-dose naltrexone. Some of you guys have probably heard about that. In treating chronic fatigue and Lyme disease. So it, like, you know, the way you're supposed to take it is like take it for a couple of days and then let off. And so you kind of your body kind of responds in this like little stressor to like put out some more ATP. And I've taken it periodically, and it can be a noticeable thing if you get a good brand of it, and Japanese knotweed is a source of it. Again, it is an invasive species, but man, it is a mainstay in Asia where it comes from. It is used in everything. It is a direct anti-spirochete. It breaks up biofilms. It inhibits the spirochete cytokine reaction. So that there has been pro-inflammatory proteins that the Borrelia bacteria actually exude themselves, which irritate you and cause you symptoms. And it actually will reduce a Herx reaction. So if you sometimes, some really hardcore doctors will really push on some patients, and we're like, we're going to ride through this Herx. Like, we're just going to do it. Like, anybody who's gone like full core keto, like, you will Herx out. Like, that's like what people call keto flu. That's Herxheimer. So Japanese knotweed can actually help support you through that. It crosses the blood-brain barrier, so it helps the blood flow. It's one of the reasons why it's such a good source of resveratrol, because that's where a lot of ATP is made, is in your brain. It's cardioprotective. It's tissue protective. It's like so much more. The only bad thing I can say about it is it's got oxalic acid in it, and so if you have like run-of-the-mill kidney stones, you probably want to avoid this. So what did I want to say about this in general? Huh? That's Japanese knotweed. Yes, correct. Yeah. So this was the one. So my husband was supposed to pick me some really nice ones on the Greenbrier, and he forgot. So I had to go around the corner where they like sprayed and grab some for you this morning. So we're gonna blame John for not having. Yeah, no, they're a little spindly. They've been like I was just saying about teasel, like it's been cut back. It's been like stomped on with chemicals. It's like on the corner of a neighbor's property, basically. But I wanted to bring you guys something that has not been sprayed. It was long sprayed ago and has come back up again. I did not bring you herbicide. And I certainly wouldn't ever tincture anything from the ground over there. So when we were in the tincture making class, I talked about a lovely book by a man named Frawley, it's called The Yoga of Herbs, and it's a really nice Ayurvedic North American like kind of herbal hybridized book. And he describes all plants, all flora, as the nervous system of the planet. And so what does that really mean? When I think about that overlaid on the subject of invasive species, it really starts to change the way I think about things, especially as I understand how things work. So let's name some invasive species. Japanese knotweed, multiflora rose, barberry, autumn olive. Those are probably like some of the big four, right? Kudzu. Yeah, another actually great Lyme one. Thank you, kudzu. Yeah, we don't have a lot of it here, but you like cross over into like Virginia and it's like, whoa, kudzu.
You got that honeyfoot, the little Nisera.
Say again?
That little Nisera, the
honeysuckle.
Bush.
Yes, yeah. Now that I'm not like aware of like medicinal value of, but sure, I'm convinced everything has some sort of medicinal value in it. So right. So let's name off some of these stuff. Barberry, full of berberine. You pull up the roots, they're yellow. What is berberine good for? Blood sugar. What do we have an issue with right now? Diabetes. It's a pandemic. Autumn olive, what's that full of? Lycopene, right? Big antioxidant, right? More than the daisy, the chrysanthemum family,
tomatoes, solanaceae.
No, but there's like it's like a Florida plant, the little for like prostate health.
Oh, Serenota saponin.
Yes, saponin. Thank you, Michael. I knew you. That's why I was pointing at you, because I knew you'd know that one. So it supposedly has more lycopene in it than saw palmetto does. Japanese knotweed, Lyme disease, that might be an issue, right? What was the other one that I named? Multiflora rose. Roses, flowers in general, especially rose, very anti-inflammatory. And we're a really flamey society these days, red and hot, especially some of us more than others. So most people like tincturing rose, just eating rose, drinking it in a tea. So if we were to go down this little woo-woo road of mine, and so we're living, being held by the nervous system of our planet, and it is sensing what we need. Can we start to change our thinking about invasive species? Because, man, when I get around some people, they are like hot, very angry and negative about it. And I am not saying that we should like let it ride, right? We shouldn't let these things stomp out our local wildlife. I'm not saying that. I mean, we have a lot of autumn olive. We keep some bushes we really like. They all taste a little bit differently, but we're constantly pulling them out of the fields and burning them and stuff. I mean, we tend our garden in that sense. We don't just let it like take over, although it's doing a pretty good job. And Katie had a beautiful story the other day when we were talking about this subject, about Japanese knotweed and somebody who was actually actively using it, and it contained itself. Like, it wasn't really invasive. It just became a plant in the backyard, and we use it, and there it is. It's always there for us. Totally agree. So, it's, that's kind of like, as far as like specific herbs, that's kind of the thought that I want to leave you guys with is, there is so much that we can all learn from each other if we sit and listen. And plants are certainly one of those things that we need to learn and sit and listen with. And I think they're talking to us by what's showing up. The last things I want to leave you with that are very directly Appalachia is wild food. So I am a big wild food fan. We have one of the problems of our food chain is that it's really demineralized, because the worst thing that we have done on this planet is destroy the soil. Our farming practices are terrible and they need to change. And so those big, juicy, tasteless bell peppers in the store and those nothing but pure sugar apples are really not giving you a lot of nutrition. Yes, they're better than like a TV dinner. But what's even better than that are the kind of slightly bitter and sour blackberries that you can pick yourself. So going from left to right, we have wild blackberries, we have chanterelles, we have lamb's quarters, we have nettles. Those are great greens. Cook them up like spinaches, put them in stews, put them in breads. The bottom is one of our favorites at home. That's sedum tornatum. So that's like one of the first things that's up in the spring. These little green astringent things that you start eating as you're taking hikes in the woods. Put them in salads. It's related to like purslane. So just juicy, kind of cucumbery. Learn to forage, because in my opinion, Appalachia's best medicine is the soil we stand on. It's clean, not everywhere. No, there is something called Charleston. There is something called mountaintop coal mining. Nobody's perfect, but you're talking to somebody who lived in New Haven in New York City for like a good part of her growing up, and drank nothing but like store-bought food stuff out of a microwave and drank chlorinated water and ended up having serious health problems in her late 20s. When I came here and started hearing things like, this is a food desert, I was literally like, what? What are they talking about? That is a modern myth. That is ill thinking. That is a disease of the mind. There is no such thing here. Should never be. Everybody can eat something out of the backyard here, as long as you're not spraying chemicals. Please, no Roundup. But clean soil is like the base of it all. It is where we get our carbon sink, right? Carbon dioxide is a problem that's going up in the atmosphere. How do we ameliorate that? With trees, with plants. And we're wiping that out. It's clean air, it's clean water. So anyway, here are just a few of the references that I came up with. I really leaned on a lot of books to get a lot of this information out of. So I skimped on you with pages, direct page references, but I can certainly point those out to you if you want to come and look at books. Most of them are outside. So before it gets too late, let's take some questions. Unless I answered everything and it's perfect.
You mentioned garlic earlier.
I mentioned garlic, yes.
And so I now have issues with garlic.
Yes. I have a book for you in my car, actually. It's called The Devil in the Garlic. So So garlic is not for everybody. Ayurveda actually does very little onions and garlic. They can actually be very pro-inflammatory. So this goes back to like, who are you, right? So we make these generalizations, right? And this is no different than medicine I would give you in clinic, right? Did that antidepressant work for you? Okay, no, let's try another one. Some people, I think vinegar is disgusting. I would never put it in my mouth. I mean, I know people who like love their fire cider vinegar. They would never start their day without it. I can't imagine swallowing it. Like, it would make me throw up. And we have to pay attention to these things. It's not just a taste, it's a visceral reaction that is way too hot for me. So there's something about garlic. It's full of sulfur compounds, which can be very anti-inflammatory, but strangely pro-inflammatory at the same time. It's a very technical book, but if you want to look at it, it probably is going to explain the answers as to why you can't take it. You might be better off with something like oregano. Yeah.
So he used to be able to eat garlic.
Mm-hmm. Yep.
And that Lone Star when he started having the food additive allergies.
Like instantly.
Instantly, yep.
Garlic made him sick, and sage. Made him sage.
Interesting. Yeah. So,
Is that all related to Lyme, or
yeah. So what is being said is that, we had a Lone Star tick bite, and all of a sudden we have bizarre allergies. Things that used to be fine ain't fine no more. I don't know. Welcome to aging. I mean, it's whether it was the tick or not. I'm always, the thing that I hear all the time is like, why is this happening to me? I haven't changed anything. Well, maybe that's the problem. We certainly, we certainly treat a 2-day-old baby different than a 2-year-old versus a 20 and a 60, and so we're always changing. We're always dynamic. If you're reacting to something, absolutely do not eat it. You will only perpetuate the problem, and you may be able to come back to it later. So what does it do to you when you eat it, if you don't mind talking about that? Oh, nice.
And rashes.
Oh, yeah.
My
So,
whole
okay.
body goes.
Yeah. So you have a problem with the sulfur aspect of it. That is a strong histamine reaction. And so you would be real. And so this is the crux of the problem with the Lone Star tick issue and the weird meat allergy that goes with it and this whole thing. So the biggest thing that helps my people is antihistamine diet. And then are actually like histamine blocking supplements, and there's actually histamine probiotics. I mean, I've had people with chronic migraines for decades who've just taken the probiotic, and they're like, and then I avoid like my histamine triggers, and it's changed my life. Yeah. And so that's something you can do, and it's great because I recommend a woman named Dr. Becky Campbell, drbeckycampbell.com. And her cookbook's like under $20. It is the most severe antihistamine diet, but it will get you there, and it is super clear. Like, her write up in the beginning is super clear. She takes you through this 4-phase thing where hopefully like you eventually taper back to like, being able to go out and like act like a normal person, like eat trash in a restaurant, right? You're like, I don't want to be that person. But it is good to have resilience in a dirty world. We do need to like surrender to that fact, right? So you can look at stuff like that and just start there. There's Seeking Health is the company that I use mostly for, like, she's got some good antihistamine supplement stuff that she compounds together, but Seeking Health is a great one. They've got the probiotics, and they're about what you would pay for supplements. They're not out of this world. Some people charge way too much for their stuff. So yeah, no problem. Other questions? Yes, Jess.
I have a couple questions, but I'm trying to get
Yeah, no, that's fine. I mean, it's one of those things. I know, like, I've been hearing your stories all day long, and it's great. Like I said, you probably hear, if you had like a particular very like pointed question about yourself, that's fine, because we do learn from it. But yeah, we don't want to like go through full histories. Come on up, gotta show everybody. You show me, you gotta show everybody.
Sweet Wormwood.
Yeah.
You mentioned that it can be very expensive in the store.
Yeah.
Do you know a local maker that, or is this something as a budding herbalist you can just go get.
I mean, I think you can just go get it and pull the leaves and dry it and swallow it and see how it works for you.
Okay. Simple.
Yeah.
Love that.
Yep.
Life cycle ticks at all stages. If they have Lyme, they would
Potentially, yes.
potentially
And we
carry
didn't. I didn't talk about this, but there is human to human transmission, and that has been documented. Remember, it's related to syphilis. How do you get syphilis? Buhner says that kids can pass it, just close family contacts. Now, you go into a biofilm quiescent period and you don't have bacteremia. Are you contagious? Probably not. So I know. We talked about it. Yeah, I know it's too late. Yeah. So I remember back when I thought I wanted to be more of a purist biologist, and I spent some time in Costa Rica studying plant life and hung out with this neat guy in the middle of the Caracas National Park, and he talked about bioentropy. Because I remember when I landed in Costa Rica, there was this guy who was pitching an absolute hysterical fit because they were making him throw his apples away, and I was like, okay, first of all, you're going to go back to Apple Land, right? Like you're in like the land of tropical fruit, but they're really tight. They're really tight in some countries about like what you can bring in, like no living plants, no like foreign organisms. Surprised they don't spray your shoes when you come in. But you can't stop it, man. Invasive species, you cannot stop it. And this is so it's kind of like the general spiritual lesson we learn over and over again, right? Like when does your life get better? When you surrender to what is and actually work with it and not fight against it, like either internally or externally. And this is the same thing. This is here to stay, and we have to figure out how we actually deal with it. So, did I go off on a tangent, or did I answer your question?
This has been a burning issue for me for a long time.
Okay.
So, there's different perspectives philosophically to look at that.
Yeah.
If you're looking at it for a human, Mother Earth is doing this for me, human.
Right.
Then you can take what you're saying about all these.
Yes.
If you're a salamander or some bird that we're losing, he can't speak for himself.
He cannot speak for himself. That's right.
So that's an ecocentric.
It is.
Philosophical thought.
Yes, it is.
So if
I absolutely agree.
Pachamama,
yes,
Mother Earth, all things living and should exist, then those arguments should be trumped by that. If you're coming from an ecocentric concept, you're coming again from human-centered.
Yes.
Only it's good for me, so F everything else off is basically what that comes to.
I don't know if I agree with that.
Okay.
And let me see if I can talk through it. So this comes to belief. So I honor you. So recently there was somebody from the World Economic Forum who stated publicly that animals have no human rights and therefore, or no basic rights like life rights, and therefore humans don't either. And I disagree with all of that. So I agree with what you just said. We should be speaking for the salamanders and the dolphins and all that sort of thing. I believe that humans are not like the end-all be-all of things, and that there is going to be some other iteration, maybe 1,000,000 years from now, maybe 150 years from now, where I don't know, maybe it's going to be the dolphins, that are the higher thinking organism. We have good evidence that the Earth has gone through iterations of rising up and total collapse, and when we go through collapse periods, we lose most of our species, right? So, but I do think human beings have a very high spiritual purpose, and that purpose is to make life more alive. And so what is good for us, and that turns us into better human beings, we can then turn it back on the planet. And so it's an oxymoron. It's a catch-22. It's a dichotomy, right? So it's both things at the same time. I don't know, and I'm not trying to convince you because
I've been through the futuristic analogy of it too.
Yeah.
So why not just throw all your trash on the road and say F everybody else, because everything's going to evolve. We're all mortal. We're all going to pass, and things will just happen, and everything will be fine. The sun's going to take over the earth anyways.
Well, I call that spiritual bypassing.
So, but so that
right.
That leads to, okay, why not just trash it? Screw everything.
Right. Yeah, no, I don't believe that either.
So
I think it's human. Right. Yeah. Well, it can, but I disagree. I mean, we have hands that are supposed to grip a steering wheel. We don't get to control the river, but we get to steer a little bit.
Right.
And so it's that is that is like the surrender to the river, but like I do have some free will. It's a really interesting conversation. Hold on just a second. I think Jess had one more question, and then did I answer your questions? Sorry, Michael. This is so fascinating, but it's a tangent, and I want to stand.
Yeah, I'm really just looking for a short answer. It doesn't have to be all of your thoughts on it.
Sure.
I'm thinking for the reference books of Buhner and for the Elitz group, would any of them give any validity to Lyme being perpetuated through government and military research?
So in that corner of the world, so the question is the very potentially contentious conversation around Lyme having been actually like coming from a lab. And so no, I have not seen anything out of any of that literature. There are people that talk about that have some very compelling arguments around that.
But if you had good literature behind it, you could say that's disinformation. Probably not a story.
There can't. Well, so it's interesting because, of course, what is the most modern? Oh gosh, dare we go here? The most modern conversation around this has, of course, been COVID. And for somebody who spent a lot of time in the molecular biology world, yes, there are things. If you know your molecular biology, then you know. You can actually see when you like do genetic analysis that there are things that have been tampered with. I just don't know how. I really. So as a human being, I'm allowed to have beliefs. When I get up in front of you guys, I don't. I want to lead as a conversation leader and stick with what we know. And at this point, would that change the conversation we're having today and what we're going to choose to do? And the answer is no, I don't think so. Right. So I'm glad you agree. So it's fascinating. In the bigger picture of things, we need to answer questions like that, because just like speaking for the salamanders, we need to like, that's a whole planet issue. If we don't need to be doing bad research like that and having it be leaky. And we know that happens. That happens more than probably we care to admit. Yes, question in the back.
It wasn't so much questions, so like kind of adding on to what you guys are talking about. I think the idea of the honorable marker is great. So the idea that yes, we have responsibility to the people that are here because we are where we are, but also the idea that like we also don't hold on to replace us and all that, but there's that piece of like only take what you need if you don't have to take everything. You don't
Yes.
take the entire stand of that plan for yourself to like create medicine. You create just what you like, take just what you need and leave the rest for the next generation or leave the next for whoever else need it or for the animals or whoever. So just that kind of like little path.
Right. I agree with you. So the comment, for the sake of the recording, the comment is on the concept of conscious and ethical harvesting and just the greater approach to the way we utilize things. And we do. Our consumer culture is a sickness, and that is really at the base of all things evil. And so I think that this conversation starts to shift when we really address it through that avenue of how we perceive our lives as necessary for the planet, because I think we are, or we can be. But how we approach our lives on the day-to-day is really where we lose our way. So that wasn't terribly profound, but I totally agree with what you're saying. No, this is good. This is kind of where I thought our conversation would go. It's like here, there, and everywhere, which is good. It's getting. Let's see here. It is 8:12, so we've been here for 2 hours, and I didn't give anybody a bathroom break. Any other questions or comments? I'm really good at not giving you guys breaks. Sorry. Yes.
That was what Joe was talking about, reacting to different things, and you mentioned we're all different.
Yes.
And you hear a lot about people being, having no appetite for meat anymore, which is happening to me. I don't want it.
Right.
And the other thing was, you mentioned one of the not about, might be something like the methotrexate we talked about. Was that the one?
Okay, so your first comment was about like sudden onset of changes, basically, and of course, dietary things are always the most remarkable things that take our notice, and that comes from a very complicated place. From the more integrative medicine side of things, that's more talking about energy funds. So meat is very hard to digest. And so when you are chronically fatigued and you have a low ATP system, so like a low like fuel source, your body is very wise. And it will say, I cannot digest that. I do not need that. And as we get older, Eric and I were just talking about this, how depressing it is how little food we need as we get older, especially for those of us who really like to eat. And we just don't, taking what you need. We just don't need that much, right? And yeah, right. And that's fine. Animal proteins have a lot of omega-6 fatty acids, which induces the arachidonic pathway, which is pro-inflammatory. So there's probably some body wisdom there. You don't need to eat meat. You're fine. Just, be careful with the veganism thing, but, yes. Question. Oh, and I was going to come back to your methotrexate thing. Hold on just a second. I don't remember what we were talking about. Methotrexate is an immune suppressant. I would never suppress your immune system. I would get it to quiet down on its own. Does that make sense? Yeah.
And there's something similar in not whatever.
Japanese milk.
I mean, you wouldn't know until you try it. And again, I'm not treating anybody today. So, yeah, you wouldn't know until you try it. So, diet first, really listen to body wisdom about not eating things that you don't want. Don't try to over intellectualize it. Be like, but the carnivore diet, it's a thing. It's working for my neighbor. Listen to that. Like when I work with clients, it's the thing that I do is like build your intuition around yourself. And how do you do that? You change what you do. What are you like without coffee? What are you like without the 2 pieces of dark chocolate that you eat every night at 10 o'clock? And it's only 2 pieces. And doesn't that have antioxidants in it? You don't know until you stop, and you'll find out what it does to you when you try to stop. And you're like, oh God, really want that coffee. So these, it's when you read stories about people who radically heal themselves from cancer or any sort of issue, or just suddenly wake up one day, when you ask them, you're like, I don't know, I just got a hit and I just went with it. I mean, it's invariably the story. So what is your question about? Can you contract Lyme disease if you eat tainted meat like deer meat with Lyme disease? No, you should be able to cook it out. Yeah, so we definitely do cook wild game, which is very, very healthy for you. That's another wild food. Didn't put deer on the slide, but when it comes to meat, deer meat's like the way to go. Yeah.
Is it possible all the sweating we're doing?
Yeah, yes. I detoxed a lot today. Yeah, for sure. Definitely helped. But anything you can do to increase your heart rate and sweat is going to be the more powerful path.
So the disease might be increasing your heart rate, causing the sweating.
Well, we're talking about you specifically, I think, and so no, you have something else that's going on, and I don't want to get into that right now. That's like a little outside the general purview of what we're talking about. Yeah, but there is, I mean, it is. I guess to kind of answer your question, it is a potential way to interpret it is like the heart rate, the sweating, like the body. The body is always trying to bring itself into balance. Always. I have patients who are like, I'm having diarrhea. How do we stop it? I was like, we don't stop it. We support it. That's a necessary process. And this is where we go wrong, right? We just swallow a bunch of Imodium and make ourselves sicker, like snap you over the counter. And this is, again, like, intuition, learning to go without and say no for the sake of it, and learning to never vilify your body.
And it might be a healthy thing.
It potentially could be. I'm not in your body. I won't interpret it, but yes, it potentially could be. So I know we're going so late. You guys are awesome. Yes, question, Annie.
I have a friend who had Lyme and moved to the West Coast and just started soaking in hot springs.
Yes.
Because it's awesome. And he swears that he cooks the Lyme elder.
Maybe so. So I can say something about this. So fever so never vilify the body. Fever has a function. The worst thing that I see parents do the minute their kid gets a fever is give them Tylenol and Motrin alternating, and they come in and they're so proud that they've been keeping this fever down, but why is he still sick after 2 weeks? So the body responds to a foreign object with a fever because fever does two things. One, it mobilizes your immune system. Your white blood cells hang out on the inside of your blood vessels with sticky little proteins, and when it heats up, they unstick and they go into circulation and move. So that is why you get something called leukocytosis. So when you have an infection and they draw your blood and they say, oh, you have a white count, right? Your increased white blood. Well, they've always been there. We can just now find them and draw them out in a syringe. The other thing is bacteria and viruses do not like to replicate in higher temperatures. They like normal body temperature. So when we immediately take an antipyretic and lower our body temperature, we're just helping out that virus. And so, yeah, sure. He cooked him out. Yep, absolutely. Yeah, Dr. Schultz has this. I don't know if you know who Dr. Schultz is. He's a guy. He's an herbal guy. He's got a really crazy detox thing that I've never tried, but looks really interesting. So you like induce a fever in an herbal bath and then wrap you in a cold sheet, and like all this stuff is supposed to come out of you. Maybe one day. Anyway. But yeah, same thing. Like induce fever, and on the background of like you prep like diet, you do this whole cleansing diet thing. You get your bowels right, and then you do this like fever induction with a draw. So detoxes are good for you. Just be careful what you choose. I teach Kitchery cleanses, which we detox with food. It's very gentle. Anybody can do it. So, yes, question in the back.
No.
Oh, right on. Right arm. Okay. Yes. Other questions, comments? You guys have been fabulous. I love talking to people like you who are so engaged.
Coffee?
Coffee?
Yeah. What's your opinion on coffee?
What's my opinion on coffee? Well, you're asking a doctor what her opinion on coffee is. We're like made out of coffee. I'm pretty sure I have like some like coffee genetics in me somewhere. So coffee is so Ayurveda says coffee is very heating and drying. That is the energetics of coffee. Intensely heating and drying. Do you need that in your body? That is how I will answer that question. And that
I had my ice cream the night before, then I might need my
you
coffee.
may need your coffee. Yeah. So I am as a hot, fiery person. I had like this much coffee this morning when I came here when it was still cool. Probably made me sweat a little bit more. I drink almost no coffee in weather like this. It will make me feel awful. It will give me rashes, like psoriasis, eczema. You people do not drink coffee, not even decaf, because it's not just the caffeine. We're talking about the whole thing. Everything in moderation. I balance mine out with a lot of cream. So that like cools it down. MCT oil in your coffee or ghee will cool it down. Cardamom will make it a little bit cooler and a little bit more pro-digestive. Anything that makes you feel jittery or crazy, it's a drug. Herbs are drugs. Food, everything has to go through your liver, right? So, you just, why are you drinking coffee? What does it do for you? What are you like without it? This is how I answer this question. So I mean, I'll never tell you like a Big Mac is good for you, but like coffee definitely has like some provable,
People
pro health
have,
issues.
Like, pain issues, and then they stop cold turkey coffee, and then it helps with like pain and inflammation and such like that.
It's very heating. It can be very pro-inflammatory. Very. So, Kevin, did you have a question?
Yeah. With some of these herbs that we talked about, can your body take up this stuff easily? Is there some like other things that you might need to like eat when you're trying to get your body to do something like juggernaut? alone? I mean,
Right. It's a good question. So the question is like, how do we pour all this herb into us, right? How do we not overwhelm the system? And that's why I've was ringing the diet and lifestyle bell, which we really didn't talk about in any sort of meaningful detail. And I know that because that's not what this talk was about. I do have a talk on YouTube that I did for Ayurveda Nights this past late winter that is on this subject. So it's called Agni and Ama, which are Sanskrit terms for basically like your metabolic fire and the toxins that you can't get rid of, in short. And so that addresses that a little bit more. But again, learning, it's everything we just talked about, like taking what you need, right? Getting in touch with your intuition. Like if you have a chronic disease, you must radically change your diet. I guarantee you that you must do something different. I've got some pretty heavy cancer patients out there right now, and we're doing some, crazy keto stuff that, in that sense, it seems a little counterintuitive. But once they get down, once you start looking at, metabolic profiles of things and you start to understand what you feed, how you're feeding, I don't want to go off on a tangent, but there does need to be a little bit of intellectual wisdom to it. It's not all just intuition. But that's almost a guarantee. If you have something that you cannot resolve and it is it's become an actual manifested disease, you must change your diet. You are overwhelming your liver, period. And all of the traditional medicine systems would agree with that. Does that kind of answer your question?
Yeah.
I mean, and then you would be looking for, overwhelm. So, I have people who come to me with lots of issues and gut problems, and they happily spill out 20 different nutraceutical bottles on the table. And I'm taking all this great stuff. I don't take pills. And I'm like, you swallow 14 capsules of dry powdered herb and oils in the morning and expect to have a gut that functions? No. So the answer is sometimes we can't. Sometimes I have patients out there who only do homeopathy and a clean diet because it's all they can take. I have patients out there who do microdoses of herbs, traditional pharmaceuticals. I've had specialists be like, how did you know to put this 93-year-old woman on a quarter, dose of Coreg? And I'm like, she's like this. I don't know. I guess, we started low, we went slow. And that is really the principle. We have to be patient with ourselves. Sometimes we have to take drastic measures because we are really stinking sick. But, that's kind of another story. Just talking about stuff in general, you got to feel it out. Adding one thing at a time is really going to lead the way to that. That's probably the best answer to your question. One thing at a time so you know. Other questions? Good question. You've been marvelous. Good night, everybody.